So the condition that I've decided to speak about for my Gen Med 2 final project is hypertrophic cardiomyopathy. So by definition, hypertrophic cardiomyopathy, or also better known as HCM, is a disease that causes thickening of the heart muscle. It is caused by genetics. It's an autosomal dominant, which means that you receive an abnormal gene from one of your parents. So if you have the gene, you're not necessarily going to develop HCM, but the gene is there. In the general population, HCM is about 0.2% or 1 in every 500 adults worldwide. And in the year 2018, the mortality rate was estimated to be 0.5% per year. So then there is a picture there that just kind of shows like the left ventricle shortened and then the thickened heart muscle. So when we talk about HCM specific to athletes, it's a leading cause of sudden cardiac death in young athletes. Sudden cardiac death is linked to sports that involve sudden movements like football and basketball. That's where we see it the most. And then most people honestly show no signs or any symptoms before suffering from sudden cardiac death. So a lot of the times we don't know that these athletes have the HCM gene because their parents don't know that they have it. They didn't know that their parents had it, and it's just like an ongoing trend. And so a large percentage of cases remain undiagnosed. But being diagnosed early can help prevent complications and can help a person manage their condition and help improve their quality of life. So did it not change? Oh, it did not. There we go. My bad. So some symptoms of HCM can include shortness of breath when being active, so with activity, or lying flat on your back. So shortness of breath when lying flat. So like when you get into bed or if you're laying on the couch or something. It can also have chest pain with activity, or if you have any fainting or near fainting. It can also be You can also be fatigued a lot easier if you have HCM. You can have abnormal heart rhythms or you can feel palpitations. And it can also cause swelling in the legs and the feet just due to the smaller left ventricle and not having enough, like the flow is not normal. So it causes the swelling in the legs and the feet. As for physical effects on the heart, HCM can cause septal hypertrophy, which is the thickened heart walls, which then causes your heart to use more force in order to pump blood throughout your body. It can also cause mitral leaflet abnormalities, which is changes to the four flaps that close your mitral valve. Excuse me. It can cause mitral regurgitation, which then causes blood to backflow into the heart. It can cause arrhythmia, which is just irregular or a fluttering heart rate. And it can cause relaxation abnormalities, which, due to the thickening of the heart muscle, causes a sluggish or, again, an irregular heart rate. So we talked about symptoms and we talked about the effects on the heart. If HCM continues to go untreated or it just gets worse because someone's not recognizing the original symptoms, there can be complications with HCM. HCM can cause AFib or atrial fibrillation, which is just another irregular heartbeat that can be fatal. It can block the blood flow. It can cause a dilated cardiomyopathy. It can cause syncope, or in other words, fainting. It could lead to heart failure. It could lead to mitral valve disease. And lastly, it can lead to sudden cardiac death. So in order to get diagnosed with HCM, there should you should know if someone in your immediate family has HCM, that there should be specific screening protocols that need to be followed. So if one person has HCM, their family members should be tested, including siblings, parents, and your children. So by being screened, your healthcare provider will take a medical history and do a physical exam and notice any heart murmurs that might be present on exam. So the screening could consist of the history, the physical exam, an ECG, or an echogram. So that's just screening for like potential, what's the word I'm looking for? Like potential that if someone, it's screening for someone that possibly could have it, but it's not necessarily a diagnostic. In order to specifically be diagnosed with HCM, you have to go through diagnostic testing, which includes ECGs, echoes, stress echoes, portable ECG monitoring. There are some other tests, and even genetic testing. So just a breakdown of the different diagnostic tests. An electrocardiogram or an ECG, it's done to look for abnormalities in the heart rhythm. So an ECG monitors the electrical rhythm of the heart. An echocardiogram or an echo can confirm the diagnosis, and it will provide a more detailed information about the heart structure. It's almost like an ultrasound. So with an echo, you're able to physically see like the heart, and you can see the thickening of the heart walls. So a stress echo involves exercising on a treadmill or a stationary bike with the echocardiogram, and then this just examines the heart's response to exertion in even more detail. And then portable ECG monitoring. This is just a portable ECG that someone can wear, and it will record their rhythms throughout the day. So then a doctor can then go back and look at it and see how the rhythms of the heart changes throughout the day, depending on like the activity of that person. Other tests that can be done could be an MRI, a cardiac catheterization, or a coronary angiography, but these are just less common types of other tests. And then in rare cases, your health provider may do genetic testing just to confirm that you do have the gene. So as far as treatment goes, HCM is not curable, but it is treatable. So treatment aims to decrease the symptoms and then therefore the chance of complications. And each type of treatment is dependent on your specific symptoms. Not one person is the same. But there are three main types of treatment strategies, which include medical intervention, implantable cardiac defibrillator placements, and surgical interventions. So just to go into more detail, medical intervention, we're talking about medicine. So the most common medicine used for treatment of HCM, it's a disease-specific medicine, is called mavacamten, if I pronounce that correctly. That is the most common in most use since it was approved by the FDA in 2022. It was a medicine made specifically for the treatment of HCM, but other medicines that were used in previous years before this new medicine became, people use beta blockers, calcium channel blockers, disopyramide, and diuretics. Now, medicines that should probably be avoided, or if they are used, need to be monitored very closely by a physician and very rarely, would be vasodilators, amlodipine, nifedipine, nitroglycerin, angiotensin converting enzyme / angiotensin 2 receptor blockers, and adrenergic receptor beta agonists like dopamine and dobutamine. So those are the medicines that could be used for treatment. One step further could be implantable cardiac defibrillator placements. So it is largely responsible for the improved mortality rate of HCM. And typically, if you have the risk factors such as you unexplained faint or have syncope, if you have a close relative who passed away from an HCM related sudden cardiac death, or if you have frequent ventricular tachycardia, these are the people who should be considered for ICDs or the implantable cardiac defibrillators, just because what the implantable cardiac defibrillator is a surgical procedure where they go in and attach a defibrillator into your heart, and it automatically knows when your heart rhythm becomes abnormal and it produces a shock if needed. So it's just if you have those higher risk factors, that's when you would need them. And then lastly, surgical interventions. So indications for surgical interventions, the New York Heart Association lists the different cardiac disease symptoms by different classes. So if you fall under class 3 or class 4 of your cardiac disease symptoms based from the New York Heart Association, which includes limitations of physical activity, but you're comfortable at rest, and your less than ordinary activity causes fatigue, palpitation, shortness of breath, chest pain, that would be considered class 3. And if you have heart failure symptoms at rest, or any physical activity causes discomfort, or syncope related to left ventricle obstruction or left ventricle outflow tract gradient of more than 50 millimeters, that would be considered class 4. And so if you have any of these symptoms and you're considered class 3 or class 4, that is when you classify or qualify for surgical intervention for this disease. So in conclusion, someone can live a long life with HCM as long as you have ongoing treatment and you're constantly following up with a physician. It's very treatable. And just some things that could help along with the interventions, certain lifestyle changes can help reduce leading your symptoms to complications. So if you keep a well-balanced diet, you keep a healthy weight based on what your physician tells you is a healthy level weight for you. Like I said before, every body is different. Focusing on low intensity physical activities versus the restricting high impact versus high impact exercises. You want to focus more on the low versus the high. If you're a smoker, quitting smoking is a great lifestyle change to help reduce complications. And then lastly, limiting alcohol intake, as when you intake alcohol, it tends to increase your heart rate and can lead more to the AFib or like the tachycardia that we want to avoid with someone with HCM. So just again, HCM is a very treatable but uncurable disease, and we just want to make sure that we are watching out for the signs or symptoms because it can go untreated for so long. We want to make sure that we know the signs and symptoms for sudden cardiac death and how to prevent it, and then this is just one of those ways. And then here are my references. Thank you all for taking the time to listen to my talk.